We focus as a program, and my research focus on a disease called pulmonary hypertension, which is a disease of the blood vessels of the lung. This is a disease that we know very little about and has actually been very neglected historically. At this point, we are beginning to see an inflection point of how we understand this disease, who we think suffer from this disease, and how we think that we can better manage it. It's a nasty disease because it's a disease that does not have a cure, and we don't have an ability to necessarily prevent it or regress the disease. So we have ways in which we can actually prevent the extension of the disease to the future, but we certainly cannot stop the onset and the ultimate progression of the disease. Yes, it is. So it again refers to increased blood pressure, but in this case, pulmonary hypertension refers to increased blood pressure in the vessels of the lung, whereas normal hypertension refers to increased blood pressure throughout the rest of the body. We think that there may be some similarities, but certainly there are major differences, and the way in which the disease progresses and the way in which it ultimately causes a lot of morbidity and mortality are very separate as well. We know some things about it, and so what's interesting about pulmonary hypertension is that it can be caused, or at least associated with, a number of different illnesses and secondary diseases, as well as mutations in our own genes and chromosomes. The issue that's actually very interesting is that this is a conglomeration of diseases that ultimately, without the connection to pulmonary hypertension, we would never put them in the same category. So it's actually an interesting model to study from a research perspective, because somehow all of these diseases are connected because of its effects on the pulmonary vessels. And that's what makes this disease so interesting, and potentially a way in which we can understand it better from that standpoint. Persons of all ages and genders do end up getting pulmonary hypertension. So we see pulmonary hypertension in even newly born babies, all the way up to very old and elderly persons, and everywhere in between. There is an interesting gender disparity. That is to say that we often find that women more than men tend to get pulmonary hypertension, but when men do get pulmonary hypertension, their disease tends to be much more severe. So there is a certain gender predilection for this disease that we haven't quite figured out yet.